Where's Mike? Mike, Diane and Dementia number 65. Home and Community Care. In Ontario, there are 14 home and community care support services organizations that coordinate in-home and community-based care for over 400,000 patients every month. We had a visit from a lay who works for HCC. She was to evaluate Diane's condition, particularly for potential long-term care. The waiting list is longer than we will ever live. This is a clever tactic to avoid long-term care. Thank you, political leaders. From what I have learned, one must first enter a private residence, and wait until something horrible happens, and then they might let you into one of 3 choices you may have made earlier, but more about that later. Their mission is to help everyone be healthier at home through connected, convenient patient-centered care. They assess care needs, and deliver in-home and community-based services. They provide access and referrals to other services, and manage Ontario's long-term care home placement process. She was quite good. I phoned earlier, and advised some questions might upset Diane. We agreed to have a private phone call later. I told her we were worried about wandering. She has emailed me a ton of resources. During the interview, it was apparent that Diane would not qualify as a priority because she bathes herself and is continent. That she experienced vertigo raised some alarm. One positive item: we were referred to a foot care program. Another detail was a toolkit for people living with dementia and their care partners to learn about the risks of becoming lost. It suggested that an unexplained absence of an older adult is an emergency. It requires the immediate involvement of police or emergency services. A lost person becomes lost from a known location: the home, a coffee shop, grocery store, or washroom in the park. Emergency responders have a specific place to start looking from. A missing person goes missing at an unknown location, thus making the situation more challenging. So far, I have been involved with only the lost scenario. I confess that I also feel lost. It's suggested we create an identification kit, such as that available from the Alzheimer Society of Ontario, to save time in the event that option A or B takes effect. Their suggestions are extensive and as follows: appearance, height, weight, shoe size, eye color, hairstyle, i.e. curly, straight, bangs, etc. Facial hair. Describe the style if applicable. Complexion. Dominant hand. Distinguishing features. Scars, tattoos, none other. Speech habits, idiosyncrasies, i.e. accent, talks with a stutter, etc. Basic information. First name, last name, former last names, nicknames, address. City, postal code, phone, cell, date of birth, sex, ethnicity, languages spoken, birthplace, current living arrangements. Health and wellness. Hearing aids or difficulties? Wear glasses or contacts? Dentures. Upper lower, none. Mobility. Uses cane, uses wheelchair, uses walker, uses scooter. No assistive device in use. Risk factors. Suicidal, confused, frustrated, depressed. Other. Please describe. Smoker. Types: cigarettes, cigars, etc. Brands: drinks alcohol? Yes, no. Frequency: types: wine, beer, spirits, etc. Brands: medical conditions and history: heart attack. Date: stroke. Date: congestive heart failure, diabetes, pacemaker, asthma, irregular heartbeat, seizures, high blood pressure, chronic obstructive pulmonary disease, COPD, mental health and related behaviors, cancer, diagnosis date, currently having chemotherapy, radiation, remission, surgeries or procedures in the last 5 years. If so, please list. Allergies. Please list, including any food allergies or sensitivities. Medications. Please list, self-prescribed medications, i.e. vitamins, herbs, dietary supplements. Please list, result of not taking medications. OHIP hash, version, family doctor's name, phone hash. Do you have a do not resuscitate form, DNR, in place? Yes, no. If so, where is it? Is a tracking device in use? Yes, no. Is there a power of attorney, POA? Yes, no. If so, who is the POA? Name, phone, email. Personality and life. Personality. Please describe habits. Please describe spiritual and cultural needs. Please describe favorite possessions, including any pets. Please describe favorite significant places. Please list triggers that could cause distress. Please list, describe. Best way to calm down. Please list, describe. Best way to communicate. Please describe. Person who knows them best is a family member, friend, other, name, phone hash, email. Are there any next of kin? Yes, no, if yes, please list, important life moments, dates and significance, typical modes of travel. Please check all that apply. Driving, walking, cycling, public transit, other, if a driver. Please complete. License plate hash, vehicle color, vehicle make and model, previous addresses. Please list and indicate time of residency, past places of employment. Please list, describe and indicate when, been lost or gone missing before. Yes, no, if, yes, how many times? 1, 3, 4, 6, 7, 9, 1, 0 plus. Where have they been found? Please list, care partner name, relationship, phone hash, email. Life in the past. Register the person living with dementia with a registry. Some communities have Project Lifesaver, or a vulnerable persons registry. For those that don't, there is MediCalert, Safely Home. Label clothing with name and care partner's phone number. Save scent, swab with a cotton ball the armpit and put in sterilized container. For use by dogs in search and rescue, use a locating device. You can compare devices at tech.findingyourway.ontario.ca. Camouflage doors to deter leaving. Provide a safe, clutter-free space to pace. Good grief. Make a copy. I'd hate to do this more than once. Put this material in a Ziploc bag and place it in the freezer for safekeeping. Leave a note on the fridge to indicate it's there. Otherwise, you will not only have to search for a lost person but also for a lost form. If you are engaged in similar struggles, please use the comment section with this video or others to describe your own situation. Your sharing helps yourself and others. I welcome your thoughts and suggestions. I also welcome your likes. If you click the logo on the bottom right-hand corner on each screen, you will subscribe to Where's Mike? New videos will automatically be sent your way, and you will not have to search for this channel. If you are looking for some humor to help deal with the weighty problem of dementia, subscribe to my other channel, The Retirement Coach. Thanks for watching.